I'm Dr. Ben Moodie. I'm a plastic and reconstructive surgeon. My primary practice is at Cintocare in Pretoria. I focus mostly on reconstructive micro and super microsurgery. It's just different kinds of reconstruction, but focused mostly on head and neck and breast and limbs, trunk, and then lymphedema. I also do some cosmetics, but mostly focus on facial plastic surgery and then body contouring after massive weight loss and mommy makeovers. Okay, so lymphedema is an abnormal accumulation of lymph fluid in the tissues. You can divide it into two general things, and you have primary and secondary. So primary is when some of the lymphatic network didn't develop properly. So it's something that it's a genetic or something that you're born with. It's not always visible when you're born, but essentially it's a developmental issue. The second component is what we call secondary lymphedema, and that is when somewhere during your life there's a specific cause that cause some kind of trouble or some issue with your lymphatic system. In our country, it's usually due to cancer surgery or different other kinds of surgery, trauma, and also then infections. So this damages certain components of your lymphatic network. It could be the vessels or the lymph nodes, and that then causes an obstruction, which causes this lymphatic fluid to build up. When it comes to symptoms, patients usually, the first thing that they notice is swelling. Initially it's a soft kind of swelling, where if you press your finger into the limb, you can see your finger imprint on the limb. We call that pitting edema. And then as it worsens, the arms are heavy, it's painful, and then as time goes by, there's more and more things that go wrong. This fluid that accumulates is an irritant to the body, so it causes chronic inflammation. Patients get chronic infections. It also causes some issues with immunity in the arm. And then you can also get some skin changes and thickening of the skin, up to a point where patients can even have this skin changes that almost looks like elephant skin. They call it elephantiasis. That's quite bad and severe. Not all patients get that, but it's something that can happen as the lymphedema progresses.